Hello, everyone, and thank you for your time. My name is Erica Beckman, and I am a nurse manager at Wellstar Douglas Hospital. Today, I would like to present to you my strategic plan for implementing a community clinic in Douglasville, Georgia. Here's a little background about Douglasville, Georgia. Douglasville is a growing city in Georgia with a population of greater than 30,000. It serves a community of several chronically ill elderly adults. So here I've put together a SWOT analysis for Wellstar Douglas Hospital. The strength is Wellstar Douglas Hospital is the only hospital in Douglas County that can also be portrayed as a weakness because it is only 108 beds. So our community has far outgrown the size of our hospital. The reputation, we're leaders in patient experience, innovation and technology, tangible volume growth, of course, and we are leaders in patient safety and quality. Some of the weaknesses are a lack of community clinic to serve Douglasville, Georgia, poor emergency department throughput. Research has shown that the longer patients are in the emergency department, the higher risk of morbidity and mortality, and increased length of stay for our patients, which also affects mortality. Some opportunities of waste reduction and cost recovery, in-house quality staffing, and emergency department throughput. So there is an opportunity to improve our patient flow through the emergency department. Some threats include im- adverse changes in Medicare and Medicaid reimbursements, increase in underinsured or uninsured patients, and patients with multiple health issues, chronic health issues. Strategic map. So here I've shown how the customer, focusing on customers, the financial aspects, the internal aspects, and learning and growth can help push this goal along. So, from the customer perspective, achieving and delivering quality care in the patients that we serve and delivering consistent and unparalleled care to our patients through that patient experience. Financial, increase in volume and revenue. So, investing in patients, investing in people, processes, and technology. Some things that we can work on internally is in improving access to healthcare for patients and having more consultant physicians and expanding access to within our geographical regions. Learning and growth, attract and retain high quality, talented nurses, physicians, so that we can provide that individualized patient centered care. So here's the strategic goal that I want to propose to you today, and that is to develop a task force of leaders basically that will determine ways to reduce costs by $50,000 per year and allocate these funds within a 5-year period to develop this clinic that will provide resources such as primary care physicians, nurses, and other clinicians to serve our uninsured or underinsured patients with chronic health conditions. And this goal aims at keeping these patients out of the hospital. Patients that are not able to afford a primary care physician or a hospital follow up. For medication refills and things like that, keeping them out of the hospital, giving them that resource, someplace that they can go to get treatment for minor things instead of bringing non emergent issues to the emergency department. So the plan includes looking at the first month, having leaders perform waste walks through every unit or department and seek out ways to eliminate or decrease access, cost, or access products and implement these changes on the units. So looking at things like for inpatient units, looking at office supplies, looking at pantry supplies, looking at incremental overtime, things like that. Implementing these on the unit and decreasing that excess cost. Within the first 3 months, collaborate with the stakeholders, nurse leaders, and community officials to establish the certificate of need. So, in the state of Georgia, before any healthcare organization is open, any hospital, any clinic, any primary care, urgent care, you have to have a certificate of need. Excuse me. So, getting that certificate of need is going to be paramount in getting this clinic started. And then within the year, collaborating quarterly with leadership, stakeholders, and community officials to see where we are, track any changes that we need to make, and see what we need to do differently. And then the communication plan. So, monthly formal meetings with stakeholders and upper leadership. And this is again, it's going to help us track our progress and see where we are and where we need to go. Quarterly meeting with sponsors and community officials. So, sponsors are people that are going to be there to provide financial assistance to us. So, we will have to keep them up to date on what we're doing. Monthly staff meetings and emails to keep frontline staff aware of progress. So, no good plan is implemented without frontline staff. So, making sure that our nurses, our clinicians, everyone down to environmental services, keeping them engaged and keeping them aware of the progress and bringing them in and gathering ideas and their thought process on what we're doing for our community is going to be very helpful. And then just providing a mixture of formal and informal communications, like message boards posted on the unit and break rooms and sending emails and, small up-to-date reminders, gathering ideas. And evaluation. So evaluation is going to be basically looking at the expected benefits and outcomes and compare to the actual outcomes. So from this, we can determine what what benefits are unmet and what we need to adjust. So say, for example, within one of our quarterly meetings, we determine that the patients are not sure of what's going on or what resources or we're going to be providing at this clinic. So bringing them in, getting them up to date, because overall the patients are going to benefit from this more than anyone. Staff perception. So finding out what the staff thinks of what we're doing, what we're providing for the community, and measuring productivity. So every good change initiative needs that amount of productivity. In determining if we're going to have the change that meets the needs of the patient. So what do I mean by this? So making sure that we have those services available, determining what needs the patient has the most. So basically, what are our patients coming into the emergency department for? And what emergency department visits can we eliminate through the use of this clinic? And then, of course, determining the cost effectiveness of the change. So is this clinic going to decrease costs for the hospital, decrease costs for the patient? At this time, I'll take any questions. And again, I would like to thank you for your time. Here is the mission and vision of Wellstar Douglas Hospital. The mission is to create and deliver high-quality hospital, physician, and other healthcare related services that improve the health and well-being of the individuals and communities we serve. The vision is to deliver world-class healthcare. This projected community clinic ties in with the mission and vision of Wellstar Douglas Hospital. While we serve the communities, we are also lacking resources on the outpatient end. This outpatient community clinic will reach far more patients, possibly hundreds of thousands more patients, and keep them out of the hospital, thereby decreasing hospital stay and readmissions.